Tanse, Unusakut, good morning, Watkwanuiradu, bonjour. I'm speaking to you today from the traditional territory of the Algonquin people. The healthcare system failed Saskatchewan. It's failed Indigenous peoples. It is a failure of all levels of government. The event we all saw reinforced the distrust in a system that can only succeed through trust. Whether it's a COVID-19 testing or the seasonal flu vaccine or eventually a COVID vaccine, that trust is essential. We must earn it and we must maintain it. Tomorrow, Carolyn Bennett and I, along with other ministers, will meet with Indigenous representatives and health professionals, representatives of Canadian health associations and representatives from provinces and territories to start the work to eliminate the systemic racism experienced by First Nations, Inuit, and Métis in Canada's healthcare system. This meeting will focus on the experiences of Indigenous peoples with systemic racism in federal, provincial, and territorial health systems. It's an urgent call for action where those present will be tasked to reflect upon the information shared, as well as the well-documented existing body of work on systemic racism in the healthcare system to inform concrete measures that we can all take so that Indigenous peoples can access the best care, first-class care, the same the rest of us enjoy. This is not a new concern, but it is an urgent one. It would be naive and betray a fundamental misunderstanding of the grave problem posed by racism and systemic racism to think that this will be solved or that we will all have answers by Friday afternoon, or that this can all be addressed by firing a couple people. Denying this problem will not make it go away. Racism kills, and systemic racism kills systematically. The federal government does not unilaterally have all the levers to address these issues and implement the changes needed. The federal government does have a legal obligation towards First Nations on reserve and Inuit in funding and delivery of healthcare services. The federal government also has a moral obligation towards all Indigenous peoples, whether they are First Nations living off reserve, Métis. We must ensure fair and equal treatment from any medical professional anywhere they are and any time that they need it. What we can also do is bring everyone together to hear from Indigenous peoples on the front lines who have experienced this racism every day and continue to experience it. What we can do is exercise our moral imperative to call out racism in all its forms, to bring together all levels of government to ensure proper surveillance, access, and accountability, to ensure that the regulated medical professions work out to stamp out racism, to ensure that Indigenous peoples are represented in the medical professions, and that the federal government uses its legitimate power in spending in these areas to make sure that these goals are met. Following tomorrow's meeting, we will provide further information on how we plan to regain that trust. Trust is essential if we are to get through this pandemic and beyond. If we've learned anything from this pandemic is that we must trust each other. And what we know is that when Indigenous peoples have control and care over their health care, the results are better, and this is proven. Le système de santé a laissé tomber et a abandonné.
The healthcare system has abandoned Joyce Ejequan and Indigenous people. It's a failure from all levels of government. The event we all saw reinforced the distrust in a system that can only succeed through trust. Whether it is COVID-19 testing or the seasonal flu vaccine, and eventually a COVID vaccine, that trust is essential. We must earn it, and we must maintain it. Tomorrow, Carolyn Bennett and I, along with other ministers, will meet with Indigenous representatives and health professional representatives of Canadian health associations and representatives from provinces and territories to start the work to eliminate the racism experienced by First Nations in Canada, Inuit and Métis. It is not a new problem, but it's an urgent one. It will be naive to believe that systemic racism problem can be solved in one meeting. It will be a great misunderstanding of the issues surrounding systemic racism. Racism kills, systemic racism kills systematically. The federal government can no longer unilaterally bring about changes. What we have to do is to exercise our moral duty to condemn racism in all its forms and bring together all the actors that can make a difference. Following tomorrow's meeting, we will share more information on how we can move ahead to earn the trust of Indigenous peoples.
Lives and all Canadians' lives at risk for the past 7 months. In recent days and weeks, we've seen an alarming rise in the number of new and active COVID-19 cases across the country. That includes Indigenous communities such as York Landing First Nation and Little Grand Rapids First Nation, where we are seeing outbreaks. Last weekend, Indigenous Services Canada deployed medical health structures to assist communities with their ability to respond to these outbreaks. 2 relief shelters have now been deployed and installed within Little Grand Rapids First Nation. And Indigenous Services Canada is working closely with Chief and Council of Little Grand Rapids First Nation, the First Nations Response and Pandemic Coordination Team, the Southeast Resource Development Council, and the Canadian Red Cross to coordinate resources in response to the community's priorities. We remain in constant communication with community leadership and stand ready to provide additional support as needed. I'd also note that we've seen an alarming spread in Saskatchewan due to a gathering at the Prince Albert Full Gospel Outreach Centre, and we continue to monitor that situation closely. En date du 14 octobre,
as of October 14th, we are aware of 209 active cases of COVID-19 in First Nations communities on reserve for a total of 906 confirmed cases, 66 individuals in hospital, 684 recoveries. In Quebec, there are 28 positive cases amongst the Inuit, and 5 have recovered except for 1. These figures are troubling. We are already seeing the consequences of the pandemic's resurgence, but we're determined to take the necessary steps to face COVID-19, and our priority is the health and safety of Indigenous people. With the evolution of this pandemic, we want to have sustainable access to health care and mental care services to support Indigenous communities. With the support line, the number is 1-855-242-3310.
Hotline for people in distress is 1-855-242-3310. Nous continuons de travailler avec
We are still working in partnerships with Indigenous organizations and communities to support the adaptation and evolution of Indigenous-led mental wellness resources and services, and will continue to do so throughout and beyond the pandemic. I want to note the remarkable leadership that enabled Indigenous communities to fare particularly well during the first wave, and I'm confident that such leadership will again make a difference as we brace for the further spread of COVID-19. And I remind everyone that staying safe means following the advice of public health experts and continuing to take the necessary steps to flatten the curve.
home, practice physical distancing, wash your hands frequently with soap and water or hand sanitizer. I cannot end this conference, however, without addressing the incidents in southwestern Nova Scotia in what amounts to an assault on the Mi'kmaq people. These unacceptable acts of violence, including the assault of Chief Sack, threats and intimidation, some racist in nature, cannot and will not fetter the right of the Mi'kmaq people to pursue a moderate livelihood as affirmed close to 25 years ago in the Marshall decision. This is a right that has existed since 1760. To perfect that right, space needs to be afforded to Indigenous leaders to continue discussions with the Department of Fisheries and Oceans and Minister Jordan. And they are not easy discussions, but they must be had and they must be respected. To do so, clearly, our police forces must foremost maintain the peace. Miigwech, Nekomik, Marsicho. Thank you. Merci à tous.
Thank you, everyone.
I omitted to mention that I'm here today with Chief Medical Officer Tom Wong, who is prepared to answer questions as well, more of a technical medical nature if need be. Thanks. Adrienne? Non, Tom va répondre aux questions.
I'll just answer the questions. So we will now answer your questions from the journalist. One question and one follow-up question.
Question, one follow-up. Nous commencerons par trois.
We will start with 3 questions from the phone.
Thank you. The first question is from Émilie Bergeron from Agence QMI. La première question est de Émilie Bergeron de l'Agence QMI. Please go ahead. À vous la parole.
Good morning, Mr. Miller. I would just like to have some more details on the emergency meeting scheduled for tomorrow. What First Nations representatives, can you give us an idea of those who have confirmed that they will participate in that meeting?
Merci, Émilie.
Thank you, Emily. First of all, the feedback was incredible so far. We have about 200 people that have confirmed their participation, and given the safety measures, we have to do so virtually, but there are 200 people that have confirmed. Yes, we did invite Indigenous leadership, obviously from national organizations, but also the chief of Manuan, the regional chief, Justin Picard. I do have an entire list. They will want to follow this. It's not up to politicians to make these speeches. I will have a very short speech indeed. My aim is to listen to people who are living these things, the health professionals. This meeting is geared primarily towards what people are living in the health sector on a daily basis, and the people in the profession. Yes, there will be possibilities for people to express themselves, for politicians to reflect on the testimony they heard in the morning. But yes, it's a meeting that's political in nature, but it's really more geared towards the experiences of people that are going through these experiences daily. And we're drawing inspiration also from reports that have been written for a long time.
The question was about the Indigenous leadership that it accepted, particularly from Quebec, and we have a number of, the acceptance rate for this has been, I think the latest check as of 10 o'clock was about 200 people had accepted to be part of this. This is a meeting that, yes, involves the participation of provincial and territorial representatives and leadership, but also Indigenous leadership. I would hasten to say that this is not a meeting that is creating a space for politicians that already have that public platform. Obviously, there will be an occasion to speak, but it is focused foremost on the lived experiences of professionals in the healthcare system, mostly Indigenous, that will be speaking about their experience, informed by the body of work that is existed and is written down on the reports, the various reports that have been issued over the last decades, and there will be a space for politicians to say a little bit at the end, reflecting on what has been said, and then moving towards a longer, medium to longer term plan to reconvene and to have concrete actions to propose and put forward. As I mentioned in my speech, the levers of the federal government in matters of health, the jurisdiction that's jealously guarded by provinces, and is something that that is limited, and we can't help but acknowledge that we must. But we do have the moral authority, legal authority, particularly in our powers to spend, which is entirely jurisdictionally and constitutionally legitimate, and also to convene, call out racism, and to coordinate and to create expectations within a system that has failed Indigenous people.
Emily, est-ce que vous avez une question du...
Emily, do you have a follow-up question? Yes, thank you. I would like to know, you mentioned the participation of representatives from the provinces. From the Quebec perspective, what representatives have confirmed their participation in that meeting? I know you're saying politicians will have a minimal intervention, but do you think it's an opportunity for the Legault government to recognize the existence of racism? Well, right now, Emily, unless I'm mistaken, I have confirmations from Minister Blair and Lafreniere and other public servants. I would not venture to say more without full confirmation. They have the opportunity to express themselves in all areas, and we want to listen to their perspectives that I respect. Maybe I should say it in English, maybe rather than French, but it's not really the opportunity to make grand political statements. We have to listen to people express what they go through every day. People who work within the healthcare system, specifically the Indigenous healthcare system, to express themselves, reflecting on issues that are well established, well known. These things have been established in the commissions that we all know, including the Vien report. Thank you. Next question.
From Kirsty Kirkup from the Globe and Bell. La prochaine question est de Kirsty.
This question is from Christine Kirkup from Globe and Well.
Hi, good afternoon, Minister. To ask you, I know I asked you recently about the federal health transfer and how that actually could be a lever used by the federal government to stipulate some standards around care and the need to address systemic racism in health. To what extent at this point has that been explored? Because I appreciate your point around, the need to have a discussion about this issue, but there is a lever that could be used, at least according to some policy experts, and I'm wondering if there's any consideration around that, given there is a discussion happening today between the Prime Minister and the Premiers.
Well, I believe, you were quoting Senator Sinclair and many others who have suggested this. It is the federal power to spend with conditions is clear. It is a constitutional right. It exists within health. The question then is how best to do it. I don't think withholding funds, particularly during a pandemic, is the right way forward. People's lives are at risk. This isn't a game. And what we really need in terms of jurisdictions are for governments to exercise their jurisdictions properly, particularly when it comes to serving Indigenous peoples to the best of their abilities. And that includes within the healthcare system. The power to spend and associate conditions to it is well documented. What we're talking about here is walking into an inherently conflictual situation and punishing people, which is certainly I wouldn't recommend during a pandemic, and I wouldn't recommend when we're trying to tackle something that falls within the jurisdictions of provinces, which is to tackle racism. Putting more money into a system which is beset by systemic issues with respect to systemic racism it can't be the only solution nor the only reply. This is about standards, it's about moral authority, it's about guidance, it's about holding professional organizations to account. And yes, sure, it's about firing people when they commit egregious acts, but it's also about learning cultural sensitivity and cultural frameworks, all paths of solutions that have been advanced so far by policy experts, but we also need to hear more and see how we can best help and foster and support those at the federal level.
Christy, do you have a follow-up?
Yeah, just as a follow-up, I'm wondering about, you specifically talked about the situation in Nova Scotia. I'm wondering, do you have any thoughts on how the RCMP handled that situation? There's been quite a strong critique by a number of individuals about the response by the RCMP. This is a big conversation right now about systemic racism in policing as well. Do you have any thoughts on that?
I do. The the first job of the police is to serve, protect, and to preserve the peace. What I saw on video is probably a limited snapshot of what went on, but it was obviously alarming. People need to be protected, and space needs to be given for negotiations to be had under very difficult circumstances with Chief Sack and his people. This is the duty of the police. Again, I hesitate to speak more about it because preserving the peace is not a finality in and of itself. It is a process that needs to be maintained, and it includes more than these acute events. That may sound a little philosophical to you, but I think it's an important takeaway from what we've seen earlier on in the year with respect to the Wet'suwet'en and solidarity movements and rail blockades. Police are an integral part of that, and their engagement with the population has been at issue in the last, over the course of this year. There's some exceptional people within the police force, and there are also some systems that are beset by systemic racism that need to be addressed. Hard to import all those thoughts into a particular video clip, but I was as alarmed as anyone that saw the videos over social media over the last few days.
Prochaine question. Next
question.
The next question is from Anne-Marie Hyven from Radio-Canada Espace. La prochaine question est de Anne.
The next question is from Anne-Marie Hyven from Radio-Canada. Yes, good morning. Thank you. The question, it's similar to what others have raised, systemic racism. Mr. Miller, you said systemic racism kills systematically, but if the Quebec government and the new Minister for Indigenous Affairs do not admit that there are systemic racism issues, how could you discuss with them? How could you debate with them? If I understood you, you said they would be present tomorrow, but how can you have a discussion? How can we listen to each other if we are on different tangents? Thank you, Anne-Marie. 2 points. The fact of not recognizing systemic racism is still very hurtful to the Atikamekw people that live this every day in a profound manner. Given the death of Joyce Echequan, not recognizing the existence of systemic racism prevents us from putting in place appropriate policies to eradicate systemic racism. So the policies all over the place, we cannot solve this problem simply by firing 2 or 3 people. We cannot really get to the bottom of these systemic racism issues within our healthcare system. So we cannot reach positive results. Denying the existence of the problem will not make it go away overnight. So my interactions with the Quebec government as an adult, I can have points of view that are not quite in accordance with theirs, but I do need their assistance to eliminate racism in the health system. They have a lot of levers, and I'm pleased to know that they will be looking seriously at this problem. This weekend, I was able to discuss with the new minister, Lafreniere. We had a great discussion. And if I am in disagreement with him, I say so. And likewise for him. We always have this annoying manner of describing our relations with the provinces like fighting, like wrestling, always challenging each other. This is not a mature way to move forward. I need their assistance. We don't have to go on all platforms and condemn what people say. This doesn't advance me much in my work in eliminating the scourge of systemic racism. We will continue. We would see where there are points of agreement and see how we can remedy the issues in healthcare, especially for Indigenous people. We want to make sure that they have first-class health care services that we, the non-Indigenous people, have access to every day.
Marie-Yvonne, est-ce que vous avez une question du suivi?
Marianne, do you have a follow-up question? Yes, a very simple question. What time is the meeting scheduled for tomorrow? I believe it's a meeting that should go on for several hours. I believe it's between 11, 10, I'm not too sure. It's at 11 a.m. Thank you. So let's take questions from the room.
Would you like to go ahead?
Minister Miller, this is for you and the doctor. I just want to talk about the number of active cases that we have in Indigenous communities. Last week, and correct me if I'm wrong, it seemed like there was 118 active cases. It seems that this week we're reporting 209 active cases. You warned last week that this second wave could be worse for Indigenous communities. How worried are you now with the numbers and the direction they're going in, that this will actually be devastating for Indigenous communities?
Well, look, Mike, I don't think any of us were as prepared as we could have been for the first wave, and certainly given the historical inequities that are well documented and the socioeconomic health gaps that exist, certainly in Indigenous communities were a step behind, and so it was of immense concern to the entire department at the very beginning, particularly as information was partial as to how COVID behaved and acted and how it would hit. So the key part at the very beginning, and I've mentioned trust, was getting information out into communities, giving the control and care of resources, particularly financial resources, but also nursing resources, PPE, all these issues that we've talked about generally in the media, to helping people stay safe. So we learned as we went, and Indigenous leadership took a number of measures that they shouldn't have had to, given the circumstances and the cards that they were dealt with at the outset, being less equipped than non-Indigenous communities to deal with this pandemic. You know, if Montreal can get overwhelmed, the healthcare system in Montreal can get overwhelmed. Certainly, a small remote community, fly-in access, can easily get overwhelmed as well, and particularly with high incidences and comorbidities that exist associated to COVID. We had a bit of luck and we worked hard, but the numbers were good. And you know, the easy comparable, and the information is impartial, are our neighbors to the south. And if you look at Indigenous communities in the U.S., the numbers that we look at from an epidemiological perspective point to Indigenous communities hit 3.5 times harder than non-Indigenous communities in the U.S. The rate at the first wave in Canada is a third of that of non-Indigenous communities. So Indigenous communities have fared better. They're now more properly equipped, but that vulnerability still exists. And you see it with the drop in vigilance and more community movement in and out, despite some of the resources that we've deployed, dedicated charter services for nurses, learning from H1N1 and making sure people are prepared, that health practitioners aren't they themselves vectors of transmission, and where COVID has popped up, communities have done exceedingly well at stamping it out. Now, you mentioned the rate of, I have 206 as the number, but it could be 209. That is, I think, the highest that we've seen it to date at any date. And so it's very alarming. The nature of the transmission, community gatherings, weddings, funerals, gatherings of a religious nature, people having parties, things we all do, is something that is very scary. And so we're continuing our work and refining our communications message and our discussions with leadership to make sure that they are prepared and that we stand prepared to provide surge capacity in communities. And we are doing things that we don't ask non-Indigenous communities to do. Isolate while it is very sophisticated medical tents, they're the result of overcrowding that can't be, you know, if you have a community where you have several generations in one household, there are people in that household that will not only spread COVID more, but particularly the elderly person. We did have a bit of luck with elderly homes. insofar as they hit harder in urban centers than they did in Indigenous communities, but we had a head start. So we warned them and we got the message out that if you need anything, we'll help you protect your elderly homes, where we have seen the largest rate of morbidity. But it's something we constantly assess and reassess, and every morning we wake up and get briefings about what's going on, and we continue to try and get ahead of things. But I would say that, yes, the absolute active case rate, even though 206 may seem small, every mobilization or every active case that sort of starts spreading in a community requires a huge mobilization that it wouldn't necessarily in an urban center. So there is a very real and present logistical challenge. Right now, it's something that we have a good grasp of, but as you see the numbers climbing and you look at the epigraphic, it's very alarming. Tom, please, if you could add.
Absolutely. Regarding this virus and what we're seeing in First Nations communities, as well as across Canada in non-Indigenous communities, we see rapid rise over the past month. This is very concerning. However, there are so many things that we have been supporting the community, and Dr. Tam has been supporting all the provinces and territories to do. We need to renew our efforts to limit non-essential travel in and out of communities, keep physical distancing, avoid crowds, avoid large gatherings, wear non-medical masks when distancing is not possible, adhere to hand and respiratory hygiene, stay home when sick, unless for medical appointments. Protect the elders. And that's one of the things that First Nations on reserve have been showing the world, that during the first wave, they have been able to protect the elders with no outbreaks, such as in the south. In the north, there's no outbreaks in nursing homes, in elder lodges, and long-term care facilities. And we need to learn from the communities. We need to support the communities. Flu season is here. We need to actually promote, the uptake of a flu vaccine, as well as the pneumococcal vaccine. And when the COVID vaccine comes, that's another public health tool to help support and protect the community. We have to have better control, support the communities for diabetes, for cardiac diseases, for lung diseases, for high blood pressure, for overweight, and address vitamin D deficiencies. Also, avoid tobacco and avoid vaping. All of those things are very important. And last but not least, importance of supporting communities in fighting the mental wellness and promote mental wellness. It is so important because it is very hard in the north to be in isolation, and yet we need to support the community and individuals and the elders and the young people so that we could promote mental wellness, both by promoting on-the-land activities. If there's no complete shutdown of the communities, if there's physical distancing, there, and avoiding crowds and wearing masks, all of those can be done because the land and the culture, is part of healing. Thank you.
Just as a follow-up to both of you, maybe, you both sort of touched on it a little bit, especially in the north with the winter coming, and in multi-generational homes with the numbers going up. At what point and what is the plan to try and figure out? Because in some homes you can't self-isolate. There are too many people in the home. So what can the federal government do to give reassurances to these communities that there will be that support, but what are you telling these communities that they need to do as we are seeing the numbers tick up?
Well, look, luckily in the far north, we've largely avoided this problem. It is clearly a challenge that we need to face. So the medical structures, the movable medical structures, have inserts that can go down to -40. It's not obviously ideal. It's not even ideal during the summer, but we are moving to ensure that we do have the capacity to deal with those acute situations. Fixing overcrowding through new house builds is extremely challenging, not only during outside the build season, which is exceedingly short in the north, but also during COVID. This is one of the reflections that we've made clear to ourselves as colleagues in Cabinet that, and reiterated in the throne speech, that we need to move a little more aggressively on closing that infrastructure gap, because we know that should we go into another epidemic, we can't go into the epidemic with that level of overcrowding and predispositions, particularly when it comes to respiratory diseases that Indigenous people face and continue to face versus vis-a-vis the second wave. And we will continue to appropriate and to adapt our surge capacity to reflect the reality of the North and the need to move quickly. It is in part why the second round of Indigenous funding had a direct distribution of capital into the communities, but also appropriation of funds to deal with increased surge capacity, to deal with specific targeted responses in communities where you see spread, as opposed to doing it in a little more even fashion, but not reflective of a spread of a pandemic from the first wave vis-a-vis the second wave. So we've taken those financial measures to appropriate those funds, but it's a constant ongoing evaluation and fail testing as we see the second wave hit. The importance, we don't want to make mistakes, but the importance is to make them now before the winter hits so that we can learn from them. Tom?
Yeah, the department has procured and acquired 144 such mobile structures, to accommodate, all kinds of needs, including the needs for isolation, for temporary accommodation, as well as provision of services. And one of the things that, just an example, recently, in Little Grand Rapids, when there's the outbreak, the community asked for, structures to be actually brought in, and the department had mobilized 2 such structures into the community for that purpose. Thanks.
Mackenzie, would you like to go ahead?
Hi, Mr. Miller. Mackenzie Gray with CTV News. On the Nova Scotia fishery dispute, the RCMP seemed to stand by when there was cars that were burnt, there was looting, there was people peeing on vans, a whole variety of things that an angry mob of fishermen did. Why did the RCMP not step in? Can the RCMP actually defend the rights of the Indigenous people in that community? And if you think they can, why should they trust and believe that they will actually be able to do that if this issue happens again?
Well, Mackenzie, I think that's a next question. You need to ask of the RCMP, and I'm wondering myself. Again, it's a video, and it's alarming to see it. I don't have the full picture of what exactly went on. Our emergency teams in government are assessing and continue to reassess what exactly went on. It's clear that there is distrust from Indigenous peoples with respect to the RCMP that predates this incident. This is perhaps more evidence to them that is the case. Foremost, the RCMP has to preserve the peace, and we expect, as a government, even though it is a delegated entity to the province of Nova Scotia, that they foremost keep the peace, and that is their job, and all Canadians expect them to do it.
I will say for the record, we've asked the RCMP and they haven't got back to us, but on a separate issue, federal government, one thing that you're able to do is convene a meeting with both the Indigenous fishermen, the commercial fishermen. This is something that the Premier of Nova Scotia has asked for, and both sides of this dispute has asked for. This is not a new dispute. Why has this not happened yet? And is there a meeting that is in the works?
First, we're talking about a fundamental right to earn a moderate livelihood that is a right that the Mi'kmaq are entitled to exercise. The Marshall decision clearly said that in elaborating what that right was based on the treaty in 1760, was that it was in follow-up commentary subject to regulation. And so that's really what we're talking about. There's concerns here, obviously, over the state of the fishery industry, illegal fishing, which is not Indigenous. It's well documented that that is occurring. So there are elements to be discussed with the commercial fishermen over a number of issues. Whether that occurs within the season or outside it is another set of considerations. It's very hard to prejudge a negotiation from my perspective. It is very important to have that and to ensure that we can get to a definition of a moderate livelihood that reflects the Mi'kmaq right that has never been defined in a way that that has been accepted by all. and that's wrong. So I've tremendous confidence in Minister Jordan in how she is negotiating with the Mi'kmaq, but there's also a discussion to be had with the commercial fishermen to educate on one hand, to sensitize, but also to ensure that ultimately they are part of the process. It's very dangerous to be on the waters without a conflictual situation. It's deadly when there is one. And so that is the risk. The risk, if we don't get this right, is that people will die. And I think everyone should be clear about what that means. Because violence begets violence. It's unacceptable, and that space needs to be created for those discussions and that place to be had to perfect a right that has existed since 1760.
Would you like to go ahead?
Thank you. Hello, Mr. Miller. My name is Mohan Hamidi. I'm with the Canadian Press. I want to ask you about the agenda of tomorrow's meeting. Now, you said there are going to be almost 200 of Indigenous leaders. They're going to be able to share their stories and their perspective on systemic racism in the health sector. But what are the specific measures that will be discussed tomorrow to address the issue, or to put in place a plan to stop at systemic racism in the public health sector?
These are questions all Canadians want to know. I would hasten to say that it's not up to me to dictate what that is. These are there's a well-informed body of work out there that exists already. So you might ask me, what's the purpose of this meeting? And the purpose of this meeting is for now over 200 people, including some of Canada's top leadership, Canada's top Indigenous leadership, to listen to those that have experienced it on a daily basis. The task then will be to sketch out and to, based on that testimonial, based on those views, based on professionals that are highly educated Indigenous professionals that are living racism every day, to see how we can all work together. This isn't a conflictual situation. This is an opportunity for people to share their experiences, their paths forward for leadership after that, in a limited fashion, to reflect on what was said so that we can have a clear pathway, for example, in January, to come back to the table with goals, pathways to ensure that professional organizations are doing their job, that there is a cultural sensitivity screening and education at all levels, that there is more Indigenous recruitment within the medical profession, that there is more education, there is accountability. These are all things that you can imagine are things that people have been asking for some time, and the breakdown of which should never have occurred. But again, it's naive to think that all the solutions will come out after one high-level meeting with a limited amount of time. But also, it just would betray how serious this is in our society in situations where people are at their most vulnerable and are at the risk of dying, and racism does kill. We have to acknowledge that. There are a variety of levels where we will need our provincial and territorial counterparts to work with us and within their jurisdictions and us within ours, and then working together in some common areas that touch and concern Indigenous peoples. But I'm not going to presuppose the conclusion of a meeting that is yet to occur. Thanks.
I have a follow-up, actually, a bit related to the question. The Canadian Institute for Health Information has been working on a plan or approach to include race-based data in healthcare. And also, yes, maybe you have heard of this before, but the the Canadian Public Health Association also is calling on all social and health services to include demographic data in their work to understand what's going on in their services, including healthcare. So, do you support this? What are your thoughts on this?
Well, I think if there's anything to learn from what we have seen during the COVID pandemic, is that if we can't do good policy if we don't have good data. Tom has been at the forefront of pushing for distinctions-based data gathering really at the front line, at the point of testing, and then following up, because that epidemiological data is key in targeting answers, actually in short-term solutions and deploying where people are more vulnerable. We've seen the data that I quoted to Mike earlier about Indigenous populations in the U.S. comes from 23 states that do, in fact, gather it. But it doesn't happen in all states, and it certainly doesn't happen in the best fashion. In Canada, we have Dr. Janet Smiley from the University of Toronto that is working on sort of disaggregating that data and getting us a better understanding of how the Indigenous population, for example, has been hit. So I absolutely support the principles. I haven't read it, but I do support the principle because we live it and we live the imperfection of data on a daily basis and our ability to act. The 906 cases that of COVID that have hit Indigenous communities on reserve is a snapshot of the Indigenous population. It far understates how many Indigenous people, for example, those that live in urban settings, those that don't self-identify, and in some cases you have a dozen jurisdictions with different boxes to tick as you get tested. So putting that all together in real time, teasing out information and being able to deploy solutions and then good public policy is certainly a challenge. And if we can head that off, I think it's something that Minister Chagger has been pushing hard at, and the various ministers in government have been pushing hard to obtain, and when we continue to do so. And I think Tom can speak more at length on that.
Thank you so much, Minister. You know, we are working with First Nations Information Governance Center. We are working with ITK and MNC, the leaders in First Nation, Métis, and Inuit, in order to facilitate discussion with provinces and territories, you know, about the collection of First Nation, Métis, and Inuit data, and to facilitate the sharing of data with First Nation, Métis, and Inuit, so that they can have the ability to analyze the data and to use the data. So this is a very important, you know, step. And so the, you know, what you mentioned about the Kai-Hai report and the initiative, we welcome, you know, such initiative, you know, when, you know, the involvement and the partnership involves First Nations, Métis, and Inuit. And for this work, we work with multiple departments, including Public Health Agency of Canada, Health Canada, Statistics Canada, Kai-Hai, et cetera. I think that, you know, Canada really needs to actually look at, you know, ethnocultural based data in order to look at, you know, the gaps. And Canada cannot do it alone. Canada needs to be doing this in partnership with the affected communities, whether it's First Nation, Métis, Inuit, or other ethnocultural groups.
On va prendre une autre question.
Take another question on the phone.
Operator.
Thank you. The next question is from Christian L. from Radio-Canada. La prochaine question.
The next question is from Christian L. from Radio-Canada. Go ahead. Morning, Mr. Miller. I would like to come back in French to what's happening in the East with the lobster fishing. Your statement earlier, you mentioned that the police officers have to maintain law and order. Do you have the feeling that this did not happen in recent events? What risk does this bring about? And if you are to intervene, what is the federal government waiting for to intervene in this matter? Thank you, Christian. I'm not sure if I heard you too clearly. The line wasn't too clear, but I saw what you saw in the social media. I don't have the full picture of what occurred, but obviously this is quite troubling to see random violence. This is unacceptable. It's racist violence against, first of all, Chief Sack. And there was the destruction of a car. There are activities that would appear to be criminal in nature. So the first duty of the police is to maintain peace, law and order. So besides what is obvious as far as the involvement of the federal government, we are currently negotiating, first of all, with Chief Sack and his people. The Mi'kmaq people have the treaty rights that have been in existence since 1760 and confirmed in the Marshall Decree. So violence cannot prevent the exercise of that law. So what we require is that the police should maintain law and order and peace. Do you have a follow-up question? Yes, thank you. I understand what you're saying, but at the same time, seen from their perspective, the citizens have the feeling that the federal government crossing their arms and waiting for the unthinkable to happen before stepping in. Are you waiting for something unthinkable to happen before you intervene concretely? No. So what are you waiting for then? Well, we're not waiting for anything really. So let's take a last question on the phone.
From Jamie Pachagomskom from APTN. La prochaine question est de Jamie Pachagomskom de APTN. Please.
Question is from Jamie Pachagomskom from APTN. Go ahead.
Hi, thank you. You mentioned an outbreak in Saskatchewan at a gathering at a full gospel center, I believe you said. Could you give some more details on how that happened with their gathering?
Thanks for the question, Jamie. It appears to be a meeting at the Gospel Center in Prince Albert. I think there's still some active tracking going on. People then dispersed and went back into their communities, so it has caused what appears to be initial outbreaks in those communities. We should have more, we're obviously tracking it quite intensely and should have more details to follow. Part of this, and it's important in all these situations, not to judge. I think when you do, it prevents people from disclosing information that is so critical in stamping out COVID, tracking and tracing and full disclosure of information. So I'm hesitant to discuss too much information publicly. But Tom, I think if you have any more additional information you can share, I'd encourage you to do so.
This really highlights the importance of many of the service organizations and institutions, facilities, really doing great work across Canada to support underprivileged and providing spiritual support. However, one of the things that's so important is, the avoiding big crowds, maintaining physical distancing 2 meters apart, and wearing non-medical masks when it's not possible to do so, and hand hygienes, and all of, the public health measures that we talked about. Sometimes, people may forget. And so we see in situations like that, in a small indoor environment, where they're gathering a large number of people without physical distancing, unlike, in this room, where we see, the physical distancing and the wearing of masks when that's not possible. So I think that this is a wake-up call, very important to remind ourselves and support each other in order to do better tomorrow. Thanks.
Jamie, do you have a follow-up?
Yes. Concerning the relief, you said you have 144 and you've deployed 2 so far. When you deploy these shelters, are you also sending like nursing resources along with it, or is it just the shelter?
Yeah, it's not. We've deployed a number of them in a number of communities, Jamie, that in fact that you've personally have covered. So that number is far greater. We could get you a detailed count of how many we have. Tom was referring to the resources that we have available to deploy in general, and prepared to do so on an expedited basis. They are used for quarantining and for testing and for isolation. They aren't intended to be permanent in nature. They're intended to be able to respond to spreads as and when they occur for specific medical purposes, being negative pressure structures that are intended for medical use but can be expanded, obviously, and adapted for the extreme cold. And it's something we're moving for the winter. But I think Tom can talk a bit more about the numbers, and if not, we can get you those information. But obviously, the 2 that we mentioned are in Little Grand Rapids, and should they need more, we're in constant communication, and I was over the weekend with the emergency team to ensure that they were being deployed. But should they need more, there will be more to be deployed.
In addition to the 2 medical structures requested by the community of Little Grand Rapids. There's a mobilization of a rapid response team together with, in collaboration with the province and Red Cross. In total, over 20 people were invited on the ground to support communities in a situation like that at Little Grand Rapids. As the minister just said, that type of rapid assistance is happening across the country in different communities when there is a need to do so. And we are on standby when the community needs more additional facilities, these mobile facilities, or need nurses, paramedics, physicians, etc.
Thank you. This concludes today's press conference. Ceci